Welcome to the Lesson 6 of the Green Skills for Nurses Planetary Health course by EFN. In this lesson, we will delve into the crucial topics of resilience and crisis management within the context of planetary health. This lesson primarily relates to the core competency 4, which involves the independent initiation of life-preserving immediate measures and the execution of measures in crisis and disaster situations. As a nurse, these competencies is vital for your ability to respond effectively in times of crisis. The United Nations Agency for Disaster Risk Reduction defines a disaster as a significant disruption of a community or society's functioning, regardless of its scale, caused by hazardous events interacting with conditions of exposure, vulnerability, and capacity. This disruption can lead to various losses and impacts, including human, material, economic, and environmental. Hazards contributing to disaster can be human-made, environmental, or technical. A disaster can take various forms, from storms and wildfires to wars, oil spills, or even building collapses. The effects of a disaster can range from immediate and localized to widespread and prolonged. Often, these effects strain the community's or society's resources, necessitating external assistance, which can come from neighboring areas or even national or international sources. It's essential to understand that disaster can have far-reaching effects, influencing the health and the well-being of populations well beyond the immediate impact zone. Disasters are typically categorized into two main types. First one, the sudden onset disasters, and the second one, the slow onset disasters. It's crucial to note that the term natural disasters can be misleading. While the hazardous event itself might have a natural origin, it only becomes a disaster when it results in losses of human life or significant economic and environmental impacts. For example, a flood only qualifies as a disaster if it causes destruction in terms of human life, infrastructure, or the economy. It's important to recognize that disasters, particularly extreme weather events, are becoming more frequent due to the climate change and the human decisions. Crises and disasters can have diverse health effects, spanning from the physical and biological environment to social factors. They can lead to contamination or destruction of water, sanitation, and waste management systems, as well as shelter. Emergencies may also elevate the risk of chemical and radiation exposure due to the destruction of infrastructure. These health effects can be categorized into three main types: direct, secondary, and indirect effects. Direct effects encompass injuries, fatalities, and exposure to hazardous pollutants or radiation directly caused by the disaster. Secondary effects include increased risk of infection, diseases after a disaster, malnutrition, mental health impacts, and long-term health consequences. Indirect effect entails social disruptions, displacement and migration, loss of livelihoods, conflicts, and domestic violence. To mitigate the health effects of disasters, we can take three different actions at various levels, from individual to global. Mitigation involves primary prevention of disasters and ecological degradation. It essentially means avoiding the unmanageable by reducing our negative impact on the environment and harnessing the co-benefits for health. Adaptation, on the other hand, constitutes secondary and tertiary prevention, encompassing disaster preparedness and response. It involves managing unavoidable by adapting to changes, building resilience, and preparing for disasters. Within both mitigation and adaptation, we can employ nature as a tool, a concept known as nature based solutions. An example of this is planting trees on steep slopes, which captures greenhouse gas emissions, reduces air pollution, and simultaneously lowers the risk of landslides due to increased precipitation. Nature can also be integrated into direct patient care, harnessing its mental health benefits and reducing the risk of cardiovascular diseases. The World Health Organization proposes several prevention and preparedness measures. Nurses, as trust healthcare providers, can contribute significantly by staying informed about the specific risk in their region and engaging in conversations with patients and communities about this risk. Depending on your nursing specialization, healthcare setting, and the patient group you serve, different aspects of these measures will be relevant to you. Your advocacy for disaster resilient health facilities can be immensely valuable in protecting vulnerable patient groups. Many of these proposed prevention and preparedness measures can only be effectively implemented collectively rather than by individual healthcare professionals. For more insight into advocacy, the Lesson 9 will provide valuable information. To respond to and recover from disasters, external assistance is often required depending on the type of disaster. For instance, in the case of sudden onset disasters, many injured individuals might require immediate medical attention in the first few hours. Ensuring that you and your colleagues are trained and prepared to respond effectively, considering your specialization, healthcare setting, and the specific patient groups you work with, is crucial. It's essential to understand the disaster risk in your region. Is it prone to wildfires, floods, or heat waves? Gaining knowledge about this risk and their implication for your patient group is a key aspect of preparation. Now, let's delve into some recent examples of disaster within the EU. Try to look at this with the planetary health lens. What wider factors led to the disaster? How does it impact health, and how would it impact your patients if they were there? Who are especially vulnerable in these crisis situations? And how does this disaster create additional environmental risk? First, let's consider the wildfires that struck Greece in 2023. These were the largest wildfires ever recorded in Europe, forcing 20,000 people to be evacuated, with a tragic death toll of 21 individuals, including 18 migrants. Over 500 firefighters from across the EU were deployed to Greece to combat the fires. Another significant disaster example is the 2021 floods in Germany and Belgium. This sudden onset flooding disaster, driven by unprecedented precipitation, resulted in over 200 fatalities and missing persons. Entire towns and villages were devastated, and the recovery process is still ongoing 2 years after this event. Healthcare facilities were also affected by the floods, and vulnerable populations like residents of a care home for disabled persons were particularly impacted as they were unable to flee from the rising waters. Notably, the most severely affected town was situated on floodplains, and despite the risk, many residents either did not receive or did not heed the extreme weather warnings. Finally, let's explore the loss of biodiversity and its potential to increase the risk associated with slow onset disasters. The extinction of numerous species is an alarming trend, with approximately 25% of all assessed species classified as threatened with extinction by the IUCN Red List. This has significant implications for planetary health in three key areas. First, nutrition is impacted as pollinators essential for agriculture are disappearing. Currently, only 12 crops and 5 animal species provide 70% of the global energy intake. This is very risky as it increases vulnerability to pests and diseases. Additionally, the lack of diversity leads to an insufficient micronutrient intake. Second, medication. The loss of biodiversity means losing potential new pharmaceutical ingredients. Third, the risk of zoonotic diseases increases due to human encroachment and biodiversity loss, particularly related to the agricultural activities. Please take a moment to watch this short video, which underscores the importance of biodiversity protection and habitat preservation. It also highlights the interconnectedness between biodiversity and the emergence of zoonotic disease, such as COVID-19. Many of us have witnessed the massive amount of plastic waste generated during the pandemic. In the next lesson, we will shift our focus to quality assurance in nursing, with a specific emphasis on reducing the mountains of healthcare waste.